Friends, today we're talking about something super fundamental, fluid volume. You have to understand it both conceptually and how it relates to various diseases. You also have to know different vocabulary words associated with it. What are the treatments? What are the labs to look at? So that's coming right up. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews, the very best NCLEX review in the entire universe, in my opinion. You can go to Clinic Reviews to find the services that we offer, clinicreviews.com. And we offer both an NCLEX review, we offer small group tutoring, and we offer a streaming service. So love it if you went there to see what we offer. Let's go ahead and get started. We're going to be talking about fluid volume today. We might as well just, I suppose, go right into the questions. I'm primarily teaching you through questions today, so that's how this is going to go. A client is admitted with suspected fluid volume overload. Which of the following signs and symptoms would the nurse expect to find upon assessment? All right, fluid volume overload. What diseases are associated with fluid volume overload? The diseases that tend to have overloaded volume are heart failure. And the reason you have fluid volume overload with heart failure is because the heart cannot handle that much fluid. And so it starts to back up. It doesn't perfuse the kidneys enough. So you're not diuresing. And so you tend to become fluid volume overloaded with heart failure. And renal failure is the other one. And that's just because the kidneys aren't working to get rid of fluid and electrolytes. So people with renal failure tend to retain fluid and electrolytes. All right. So that's sort of where we're at. So suspected fluid volume overload, increased volume. All right, edema. Well, if you have increased volume, you're going to have third spacing. So that's, yes, you're going to have edema. If you're increasing volume or overloading volume, you'd have weight loss. Well, that's false. You'd have weight gain. In fact, 2.2 pounds equals 1 kilogram. And 1 kilogram equals 1 liter. So 1 liter weighs 1 kilogram, which equals 2.2 pounds. So for every 2.2 pounds the person gains, and that's like overnight, not over a week. Yes, if you gain 2.2 pounds in a week, you probably are gaining fat weight. But if you gain it overnight, you probably just retained a liter of fluid. If you lose 2.2 pounds overnight, so sorry to tell you, you didn't just lose fat, you lost water. You probably lost a liter of fluid if you lost 2.2 pounds overnight. So weight loss is associated with dehydration, not with volume overload. Hypertension. Well, as serum volume goes up or intravascular volume goes up, blood pressure can definitely go up. So in general, fluid volume overload is associated with hypertension. Dry skin. No, that's not a common expected symptom with fluid volume overload. And even if you say, well, I took care of a patient one time. Okay, y'all, it's not about the one patient you took care of one time. It's saying in general, are these the symptoms of fluid volume overload? Crackles in the lungs. Well, if you overload volume, it can get into the lungs. It's called pulmonary edema, just like peripheral edema is fluid in the third spaces in the ankles and the abdomen. It's ascites and so forth. So if you get fluid in the lungs, it's called pulmonary edema. So yes, jugular venous distension. Well, if you have increased vascular volume, your jugular veins can distend. So these are also actually the symptoms associated with heart failure. And they definitely can be associated with renal failure. Renal failure is a little different in some of their symptoms, but if they're fluid volume overloaded with renal failure, then they're still going to have these symptoms. Which of the following complications is a client with fluid volume overload most at risk for developing? Hypotension, pulmonary edema, hypokalemia, or dehydration? Well, if they're volume overloaded, I know dehydration is not the problem. Hypotension, I would be more looking for increased blood pressure with increased volume. So I'm going to cross off A and D. So pulmonary edema, well, that's fluid in the lungs. So is that associated with overall increased fluid volume? It is. How about hypokalemia? So you may say, well, maybe hypokalemia is serious. If they get, I better pick that. No, you better not. You better pick the answer you know is associated with fluid volume overload. Don't pick the answer you're not sure about over the answer you are sure about. Okay. You have to make sure you don't overthink, second guess yourself, and pick the wrong answer when you know what the right answer is. A nurse is caring for a client with fluid volume overload, so increased volume. After auscultating crackles in the lung bases, which is pulmonary edema. Which of the following is the priority nursing intervention? Monitor daily weights. Well, yes, I'd want to do that. Assess for skin breakdown. Not so much. Restrict sodium intake. Yes. Administer furosemide. All right. So A, C, and D are all important to do with fluid volume overload. So I should do all of them. But what's the priority? What's best? What do I have to do? Well, what's the problem here? What is the problem? Increase volume and volume. You got fluid in the lungs, which is serious. What's the best way to get fluid off the lungs? Is it to restrict sodium? No. Is it to monitor daily weights? No. Is it to give a diuretic? Yes, that's the best way to get fluid off. So even though A and C are appropriate, the most important or the priority for this patient is giving a diuretic. Which of the following treatments would the nurse anticipate for a client with decreased intravascular serum volume? All right, that's a lot of words. You have to be able to read the question and interpret it appropriately. So decreased volume, let's cross off intravascular and serum. Decreased volume, if you have decreased, well, what kind of volume? Intravascular serum, what's in the vessels? It's fluid. So increased fluid volume, decreased fluid volume, decreased fluid volume. When you have decreased fluid volume, what do you call that? Call that dehydration. This is a dehydration question. It's a low volume question, okay? So when you see words like decreased intravascular serum volume, you go, gosh, I don't use those words very often. So what words do you use? I use the word dehydration. Well, then let's use it. Which of the following treatments would you anticipate for a client with dehydration? IV fluid administration. Well, yeah. Diuretic therapy? No. Sodium restriction? No. Antihypertensive medication? No. Well, then what are you going to give? I'm going to give fluids. That's the right answer for dehydration. A client is admitted with fluid volume overload. Which of the following labs would the nurse expect? Decreased sodium, elevated hemoglobin, decreased blood glucose, or elevated potassium. So here's what I want you to remember. Whenever you see a volume question and a lab associated with it, volume and lab, you always, it's almost always going to be sodium, some type of sodium issue. Okay. Because as volume goes up, it decreases the concentration of sodium. So sodium level goes down because it's less concentrated. Less concentrated. So volume goes up, sodium concentration goes down. As volume goes down, sodium concentration goes up. It becomes hyperconcentrated. So sodium level goes up as volume goes down. As volume goes up, it becomes less concentrated and sodium level goes down. So as volume goes up, sodium level goes down. As volume goes down, sodium level goes up. So they're the opposite. And always look for a sodium answer with volume questions, okay? So which of the following labs would you expect? Decreased sodium. Well, it's got sodium. I'm going to keep it on my list. Elevated hemoglobin, decreased blood glucose, or elevated potassium. So I only have one sodium option, so that's nice. So volume overload. So volume goes up. What would I expect sodium to do? Go down. We have decreased sodium. Absolutely. Decreased sodium. Now, blood glucose and potassium should not really be effective. What about hemoglobin? Actually, as volume goes up, it can sometimes also dilute the hemoglobin level. So you can see, actually, as volume goes up, you can see hemoglobin level goes down because it's less concentrated or more dilute. So you definitely wouldn't see an elevated hemoglobin. If anything, you see a decreased hemoglobin. A nurse is teaching a client with fluid volume overload about dietary restrictions. Which of the following statements should be included in the teaching? Okay, fluid volume overload and diet. So fluid volume overload. So volume is up. You should increase your intake of potassium-rich foods. Potassium really doesn't have any effect on volume, so I'm crossing that off. Limit your daily fluid intake to 2 liters. Well, their fluid volume overloaded, it's saying to limit fluid, so I'm going to keep that on my list. Avoid foods high in sodium. So I know sodium-rich foods can cause you to retain fluids. They're already fluid volume overloaded. I'm going to keep it on my list. Increase your protein intake. No, that doesn't have anything to do with it. So I do want to limit daily fluid intake, and I also want to avoid sodium. So the question is the fluid intake limited enough? So here's your answer. The recommendation for fluid intake for a healthy adult with no comorbidities is 2 to 3 liters. That's 2 to 3,000 mils a day. So that's the low end of normal, but it's still normal. If you want to restrict fluids, you got to restrict it less than 2 liters. 2 liters is not enough of a restriction. So the only one here that makes any sense for someone who's volume overloaded is to avoid foods high in sodium. A client is admitted with a diagnosis of hypertonicity. Which of the following signs and symptoms would the nurse expect to find upon assessment? All right, we got to figure out what hypertonicity is. Hypertonicity is hyperconcentration. What is concentrated? The blood. The blood is concentrated. Intravascular volume is concentrated. All right, hypertonicity, intravascular volume is concentrated. How does that happen? It happens by dehydration. So what is this question? This is a dehydration question. Have you ever heard of HHNK? Hyperglycemic, hyperosmolar, non-ketotic coma. Hyperosmolar means the same as hypertonic, okay? So HHNK is associated with dehydration. Hypertonicity is also dehydration. So all these words, vocabulary words, you should be familiar enough with them to be able to interpret them on the NCLEX. These are words that you have to know what they mean. So this is a dehydration question. Dry mucous membranes are associated with dehydration. True. Elevated blood pressure is associated with dehydration. False. Decreased skin turgor is associated with dehydration. True. Increased urine output is associated with dehydration. False. Tachycardia is associated with dehydration. True. So as volume goes down, remember, cardiac output is heart rate times stroke volume. Cardiac output is heart rate times stroke volume. So as volume goes down, in order to maintain cardiac output, what has to happen to heart rate? It has to go up. So if volume goes down, heart rate has to go up to maintain cardiac output. That's why tachycardia is a symptom of dehydration. So yes, tachycardia is true. Cool, clammy skin, no. Increased urine specific gravity. Well, increased urine specific gravity is hyperosmolar or hypertonic. So yes, it's going to increase urine specific gravity. So those are the signs and symptoms of dehydration. Which diagnostic test would the nurse expect to be ordered to evaluate for the complications of heart failure in a client? So I use the word heart failure here for a reason. I wanted you to understand that I could say increased or fluid volume overload, increased volume or fluid volume overload, or I could say heart failure. The answer is going to be the same because heart failure, although it's causing fluid volume overload for a specific reason, from a nursing perspective, we're most concerned about the fluid volume overload. So what is a complication of fluid volume overload? Well, where can it go? Where can the fluid go? It can go to the lungs. That's why we're always listening for crackles, right? So crackles in the lungs, what does that tell you is in the lungs? Fluid. What's another word for fluid in the lungs? Pulmonary edema. How do you pick up pulmonary edema? Chest x-ray, y'all. Do you see? This is a clinical reasoning question. It does not seem complicated when you first read it, but it is a clinical reasoning question, and you have to be able to take multiple steps to get to the right answer. See, it doesn't say the answer is not pulmonary edema. The answer is how you're going to pick up pulmonary edema, and it's a chest x-ray. Which diagnostic test would the nurse expect to be ordered to evaluate the extent of dehydration? So that's different than the last question. The last question was complications of heart failure, which is pulmonary edema, and you pick it up with the chest x-ray. Here, we want to know how dehydrated they are. Well, what's the best way to determine how dehydrated they are? It's looking at concentration, and we don't look at blood concentration. We look at urine concentration, and we look at it using a urinalysis. A nurse is teaching a client with dehydration about ways to prevent it in the future. I want to prevent dehydration. Good. Which of the following statements should be included in the teaching? So preventing dehydration, limit your fluid intake to 1 liter. Well, that's not enough. That's not going to prevent dehydration. Increase your sodium intake. Well, it will cause you to retain fluid, but a lot of times that fluid ends up going to third spaces and not necessarily intravascular. It doesn't really help hydration status, to be honest. Sodium, increasing it doesn't really help. So I don't really want to do that. Avoid caffeinated beverages. All right. What is caffeine? It's a stimulant, but it has something else it does. Did you know caffeine has a diuretic effect? Did you know that? You got to know that. That's why we say avoid caffeinated beverages for people who are prone to dehydration, because caffeine is a diuretic. And you might go, well, I drink caffeine all the time. It doesn't do that to me. Well, okay, fine. But I'm just telling you, the rule is caffeine is a diuretic. And if you're prone to dehydration, you don't consume it. Consume high protein foods. That has nothing to do with dehydration. So if we want to prevent dehydration, they have to avoid caffeinated beverages. The nurse is caring for a client with renal failure. Which of the following nursing interventions should be included in the care plan? All right, renal failure. Well, they're prone to fluid and electrolyte retention. So they're prone to fluid volume overload, and they're prone to retaining those electrolytes that normally would be excreted in with the kidneys. All right. And then there's just kidney stuff too, I guess, to take into consideration. But let's see, monitor intake and output. Well, yeah, if they're prone to fluid retention, I want to monitor intake and output for renal failure. Push fluids. Well, they're prone to fluid retention, so I don't want to push fluids if they're prone to fluid volume overload. Apply compression stockings. That's a specific symptom for edema. So if they have edema, I can do that, but it doesn't tell me they have edema. It just tells me they have renal failure. So what I'm really doing is I'm trying to prevent the complications of renal failure, and compression stockings don't do anything. So specifically for renal failure, okay? If it said renal failure with edema, I'd go, yeah, compression stockings, absolutely. But it's just a general question about renal failure. So I'm going to monitor intake and output. I'm not going to push fluids. I'm not going to apply compression stockings. Administer prescribed diuretics. Well, they're prone to what? They're prone to fluid retention or fluid volume overload. And diuretics can help with that. So yeah, I'm going to administer diuretics. Provide low sodium diet. They're prone to fluid retention. So low sodium diet is pretty common intervention for that. So yeah, restrict fluids. Well, they're prone to retaining fluids and fluid volume overload. So if I restrict fluids, remember, restricting fluids means under 2,000 mils a day. Okay, under 2,000 mils a day prevents fluid volume overload for people who are prone to it. So yeah, I'm going to restrict fluids. Watch for hypokalemia. All right, they're prone to fluid and electrolyte retention. So if they're retaining potassium, are they going to be hypokalemic? No. And don't go, well, maybe it's a concentration issue. It's not. Sodium is a concentration issue. Potassium is not. So they tend towards hyperkalemia, not hypokalemia. All right. So those are the correct answers. A client is admitted for heart failure, pulmonary edema, and 3+ pitting edema in the ankles. Which of the following indicates that the prescribed diuretic regimen has been effective? So we're giving them diuretics for heart failure and fluid volume overload. Heart failure, basically fluid volume overload. They have pulmonary and peripheral edema. So what is going to tell me this diuretic worked? Increased urine output. Well, that's what I would expect it to do. Weight gain. No, I don't want them to gain weight. They should lose weight, actually, because if they're losing volume, they should lose weight. Increased appetite. No, doesn't do anything for that. Clear lungs. Yeah, I mean, they have pulmonary edema. So clear lungs would tell me we got rid of the fluid in the lungs. So this is a little bit of a trick question, because you may say, well, there's two right answers. There's not two right answers. If their urine output goes up, but their lungs don't clear up, is this an effective diuretic regimen? No. What has to happen in order for me to know it's effective? Their lungs have to clear up, y'all. That's why I'm giving it to them, to clear up their lungs. They're fluid volume overloaded. I want to see signs that fluid volume is decreased. So I want to see weight loss. I'm going to monitor intake and output. I want to see weight loss. I want to see clear lungs. I want to see decreased edema. Am I looking for increased urine output? Well, that's going to happen as they lose volume, but that's not the primary thing that tells me it's been effective. Clear lungs is. A client with dehydration is receiving IV fluids. Which of the following laboratory values should the nurse monitor most closely? Okay, dehydration, that's a volume issue. Is the volume up or down with dehydration? Volume is down. So what is the lab? I said you always monitor with a volume issue. You always monitor what? Sodium. So if sodium's not there, I'm in trouble. Hemoglobin, blood glucose, sodium. white blood cell count. Pick sodium, y'all. It seems too easy when you learn it, but I'm telling you what, you're going to get these answers right every time because sodium is always the right answer when it comes to volume questions. The nurse is caring for a client with dehydration. Which of the following nursing intervention should be included in the care plan? Dehydration. What are we going to do about it? Monitor intake and output. Yes. Push fluids. Yes, they're dehydrated. Means give more, encourage more than 3,000 mils a day. We're pushing fluids. That's more than 3,000 mils a day. Elevate the lower extremities. That's not going to help with dehydration. Administer diuretics. Well, that's definitely not going to help with dehydration. Provide oral rehydration solutions. Well, yeah, sure, that helps. Fluid restriction. No, I'm going to push fluids, not restrict them. So again, common sense, but you've got to think about, is this low volume or high volume, right? Think about the words and what they mean and what do we do for these things. It's easy if you're not thinking about it and concentrating, it's easy to forget what you're really looking at. After implementing the prescribed treatment plan for a client with hypertonicity, which of the following outcomes indicates effective treatment? So hypertonicity is what? Dehydration. That's what it is. Remember, I taught you that several questions ago. So after implementing the prescribed treatment plan for a client with dehydration, which of the following outcomes indicates effective treatment? How do I know they're no longer dehydrated? Increase in blood pressure. Yeah. Decrease urine output. No. If they're dehydrated, the urine output, if they're hydrated, their urine output should go up. So no, that's not effective treatment. Presence of dry mucous membranes. No, that means they're still dehydrated. Development of edema. No, that means I fluid volume overloaded them. That's not effective treatment. Okay, no. So D is definitely out. C is still dehydrated. B is still dehydrated. We're looking for effective treatment for dehydration. So even though I don't necessarily think of increased blood pressure as indication of effective treatment for dehydration, in this question, it's the right answer. Remember, the right answer is the right answer because of the other answers, y'all. That's why you don't really use test questions like test bank. You don't use test banks to memorize content. Okay. You have to understand conceptually what's behind it and understand the right answer is the right answer because of the other answers. If you need content, ooh, my finger's not doing this right. See the blue book right here? Blue book is right back there. Okay. Right there. If you want content facts, you can get the blue book on Amazon. You can also do the NCLEX review with us. You can do the small group tutoring with us if you want to. Oh, that's it. That's the end. All right. Well, I hope that was helpful to you. As you're getting ready to take your NCLEX, I get messages from people all the time telling me they passed NCLEX, that they found these videos helpful. So let me give you one more recommendation. I get just as many people telling me they passed at maximum questions as tell me they passed at minimum questions. So you can pass at 85, you can pass at 155, y'all. Do not give up when it flips over to 86. Okay, you're still passing. If it flipped over to 86, you're still passing. If it flips to 96, you're still passing. 110, still passing. 125, still passing. 135, you're still passing. Don't give up. You have to go unprepared for 155 questions. If it goes all the way to 155, very good chance that you still passed. Very good chance you still passed. If you pass at 155, send me a message and let me know about it. All right. I hope you have a great rest of your day. Thanks.
You got to look into that camera right there. That's where it's recording it. You look up there. Right there. And then you up and see. Like that? Mm-hmm. No, the microphone's not hooked up right now. So we can look up.
Talk into the microphone. Don't push any buttons or it'll turn it off. Talk into the microphone. Say, hello, lady. Hello, lady. Yeah, let's turn this over here so we can see you better. There, I see you better.
Is that Gemma? Is that Gemma?
Oh, no.